Hello, I'm Dr. Craig Stern from Pharma Pharmaceutical Consultants. We've spoken over the last several sessions about drug cost and what does that mean when we talk about what the benefit or the plan would pay for drug cost with ingredient cost plus dispensing fee plus copay or plus tax minus copay. But what we haven't spoken about is utilization, and utilization is critical. It's the multiplier. What we really need to understand is that drug cost is not the only thing that a plan pays for. It must be multiplied by the utilization or the usage of that particular drug, and that utilization is critical because it multiplies every drug cost. And for every branded cost, let's say a branded cost is $150 per prescription. If you have 5 brand drugs, then it's $150 times 5. If a generic drug cost is $22 and there's 10 generic drugs, then it's $22 times 10. So it's not just a matter of dealing with a generic or a brand drug cost. It's a matter of dealing with utilization. Now, when health plans or providers or others deal with overall pharmacy benefits and drug cost and utilization, it's easier to deal with drug cost because you can negotiate with someone to get a better deal. You can ask for a 10% discount or a 20% discount or something that is going to give you some unit discount over what you pay. What is more difficult is to deal with utilization because the company that is selling the drug or the group purchasing organization or the provider or otherwise, they can deal with what the drug cost is. They can deal with getting a discount with volume and buying more. But they can't control how many prescriptions a patient uses. They can't control how a physician will utilize the drug. And so as a result of that, the utilization is much more difficult to handle. Just to give you an example, utilization is really based on the physician's pen. What we think of is how many and prescriptions that may be written that are appropriate and prescriptions that are written that are inappropriate. And if they're inappropriate, then that means that we have paid for medications that a patient doesn't need. For example, antibiotics for treating viral infections. They're unnecessary. They add further complications. They add antibiotic resistance. And at the end of the day, they have increased the utilization so that either a generic prescription is multiplied or a brand prescription is multiplied. Dealing with utilization is a huge issue. Over the years, pharmacy and pharmacists have dealt with it through drug utilization review programs. They have dealt with it by trying to deal with appropriateness tests on prescriptions. They've looked for inappropriate types of prescriptions that may, for example, there's no diagnosis for the drug that's being given. And on a one-by-one basis, pharmacists work with patients and with doctors to identify through medication therapy management, through other kinds of programs to try and decrease the total usage. But at the end of the day, if the utilization cannot be controlled, then drug cost may be decreased, and it may be decreased by 5 or 10%. But if the benefits are going up at a greater rate, then this particular issue needs to be managed more aggressively, more appropriately. And if you don't look at that and you don't have very strong aggressive programs, then there isn't going to be a appropriate kind of cost control. The last thing that really needs to be emphasized here is that this is not about taking away drugs from people who need them. In fact, it's about making sure the people who need drugs get them. But it is also about ensuring that inappropriate drugs are not given, that drugs are only given for an appropriate period of time so that you know that they have been successful, that there's a target that has been established for what the drug is supposed to do, and the drug is not given for any time longer than that. And especially, for example, in elderly patients, there are many drugs that are inappropriate and that cause further problems, whether it's falls and they break a hip, whether it's issues with regard to making people dizzy or more sedated or something. There are a host of issues. So this is not about bad medicine. It's about good drugs doing good things versus good drugs doing bad things. We'll talk further about benefits in the next, in our next presentation. I wish you all a very good day.